Welcome to Boston University's Sargent College, the College of Health and Rehabilitation Sciences. I'm Gloria Waters. I'm the Dean of Sargent College, and I'm really delighted to welcome members of the Boston University community and also the Boston community to our 13th annual Dudley Allen Sargent Lecture. So this lecture was started in 1999 on the 70th anniversary of Sargent College actually joining Boston University. And it was started to honor our founder, Dr. Dudley Allen Sargent. So for those of you who don't know anything about the history of the college, Dr. Dudley Allen Sargent was really an individual who was ahead of his time in terms of understanding the importance of lifestyle, including diet and exercise, to human health. And he founded Sargent College in the late 1800s with that vision in mind. And so now every year, in order to honor Dr. Dudley Allen Sargent and to commemorate our joining of Boston University, we invite a preeminent speaker in the area of health and rehabilitation to talk about some current healthcare issue that's of interest to the Boston and Boston University community. So today we're really honored to have Dr. Robert Post give the lecture. Dr. Post has been the Deputy Director of the United States Department of Agriculture's Center for Nutrition Policy and Promotion, and he directs the USDA's programs that are designed to set nutritional policy at the national level and also nutrition promotion and outreach programs of various sorts. He's been responsible for overseeing and planning development and review of the 2010 Dietary Guidelines for Americans, which we've all heard about, and also programs such as the Healthy Eating Index and the USDA food plans. And he led the effort to make the mypyramid.gov the most widely accessed website in the government, or in history, actually. Dr. Post has been in the field of nutrition and public health and food and agriculture for over 30 years. And he's an adjunct professor in nutrition and food science at the University of Maryland. And he has background in public health, nutritional epidemiology, and also you'll see he has become somewhat of an expert in communications and how to get your message out to the public. So we look forward to your topic today, and welcome to Dr. Post.
Thank you. Thank you very much. I never get the students in my class to fill up as many seats as I see here. And they're required to be there. And thank you, Dean Waters. Thank you also to Joan Salgi Blake, and also to Lisa Tomatori, to them to help make this possible, to inviting me and enabling me to share some what I think is sort of groundbreaking in some ways and engaging, and I'll probably say that term over and over and over, and dynamic, some things that relate to the 2010 Dietary Guidelines for Americans and the fresh approach that USDA is taking to communicate the guidelines and get people to really recognize that we really need to shift our eating patterns to more healthy ones. So there hasn't been a time that I can remember where nutrition has had such high visibility, certainly in an administration, where among the top priorities in this administration, you've got hunger issues, on the other side of the spectrum, and then you've also got the need to shift our eating patterns to more healthy ones because of concerns for healthcare costs, because of concerns for increased or continued productivity. So we've got a lot of impetus here to really get the dial to move in the right direction, maybe the dial on our bathroom scales, and get people to have the choices they need, to be inspired by the messages they receive, and actually make a difference, even if it's stepwise, in improving their health and their lifestyle. So that's what this is all about. And it's a matter of empowering consumers, really. It's not a matter of dictating. It's not a matter of prescribing healthy choices. It's a matter of providing options and choices and hopefully inspiring consumers to make those healthier choices. So I'm going to talk to you about what we're doing, and talk a little bit too about the Center for Nutrition Policy and Promotion, which is what we believe is mission command when it comes to dietary guidance and implementing the dietary guidelines in the federal sector. We share this, of course. USDA does that with the Health and Human Services, with the Department of Health and Human Services, of course. But as far as the center goes, we think we are the center of the nutrition universe. So with that lofty introduction, let me tell you a little bit about MyPlate. How many of you have seen MyPlate? How many of you have seen your own plate? I hear from some late night folks that we're just eating out of bags anyway. But no, I think a plate resonates, right, with most of us, and we're all familiar with that. And that's what makes this really a very attractive and engaging icon. And we did, I thought I'd sort of like tell you a little bit about MyPlate and our experience so far. Since June 2nd, we actually released, with the First Lady's help, this new icon. And I'll tell you what it means. I'll tell you what it really is based on in terms of the research. And it is, in fact, not only an icon, but we also released on June 2nd a multi-year, multimodal communications campaign to implement the dietary guidelines. And we had the help of the First Lady, as you see here, and Secretary Vilsack, and Surgeon General Benjamin. So we had some good company and got a great deal of exposure for our kickoff, and we're very, very happy about that. It really brings home the issue of improving our healthy choices, but also, because of the affiliation with Let's Move, it also shows that we're not only talking about healthy choices, we're really also talking about balancing those choices, those food choices, with physical activity. So there's a great synergy between these two campaigns. So what have we heard about the MyPlate and certainly the media take? And these are some quotes. If you haven't picked them up in the news, we have. Many nutritionists and nutrition groups praise the newest effort. They hope people will listen. We hope people will listen and make changes. From a practical point of view, the plate image will help people focus, help people make better food choices. And nutritionists say this is a graphic that anyone can relate to. We've got USA Today quote, which we're happy to receive down there at the bottom. And then we've got certainly the Washington Post, really with a very good quote. And it's no fun finding nothing to be snarky about. Very current quote, current words. So we think we've really struck on something here. And it's been a success since let's see if I can, there we go, thanks. Okay, so some of the other places that you will see information about MyPlate and the MyPlate communications effort. And these are just some. In a minute, you'll see the Times of India. Obviously, we've gone worldwide. We know that there are efforts to create an Israeli version of MyPlate and other places in the world as well. And so, obviously, this is a symbol that resonates and is familiar to consumers just about everywhere. And in that regard, we've really struck on something then that will be easy, an easy guide to follow. You know, we've got a quote from Sam Cass at the bottom in the Chicago Tribune. We've got a CNN quote about the plate icon is really there to guide Americans to healthier eating, and that the idea of filling up a healthy plate is what it's all about. Oops. Thank you. That's better. Okay, so we went out there sort of like a man or woman on the street, and thought that we'd get some feedback.
What I think of MyPlate from USA, I think it seems like a way to make a balanced food distribution for every meal. So have a little bit of everything you need to have a healthy nutrition.
What I'm getting is, how you should, what foods you should eat and how much.
Simplified picture to show you what it is that you should be eating to make yourself healthy.
Fruits on there, grains, proteins, and vegetables. Things that we like,
Yeah, we did not pay them to say fruits and veggies, foods that we like. Good way to end that little clip. And by the way, that was our first foray into embedding videos into our presentation. So I hope you enjoyed it. And I had a very hardworking intern out there on the mall, and you could see the Capitol in the background, trying to protect himself from the wind to get this for us. So, and we've got more coming. So that gives you, here we've released this in June, and we already have some views and an understanding of what this is about. So we're really enthused, and I think that's a great way to really start my presentation and give you sort of the build-up, and then talk about this a little bit more in detail and our whole communications effort that's really built around this centerpiece that is this new food icon. So many of you, of course, were glued to your, wherever you receive your webinars, you know, whether it was at your computers or elsewhere, glued to the process of setting the dietary guidelines for Americans, right? I'm sure. I was. You could find me there. And you know, there's a long drawn-out process that's a very thorough and exhaustive one, a transparent one, a very dynamic one in the work of an external committee of experts that meets over a 2-year period to evaluate and analyze and weigh the evidence and ultimately come up with conclusions to big nutrition-related questions, all of which can be found at nutritionevidencelibrary.gov, which is the USDA's nutrition evidence library that supported the 2010 Dietary Guidelines for Americans. And in that work, ultimately, you find a review of 2,000 or so manuscripts, and ultimately the conclusions to an awful lot of these big questions that then become the basis for the Dietary Guidelines for Americans. So we've gone from a 445-page comprehensive report to a 96-page plain language document written in plain language aimed at nutrition educators, health professionals, and policymakers primarily. And actually that's the work then that becomes the work of the federal agencies. My agency had the leadership for the 2010 Dietary Guidelines, and so we took 445 pages, kept the science, but put it in a way or crafted language to make sure that it was understood and applicable to the actual implementers of the science. And that then became the 2010 Dietary Guidelines for Americans. We released that in January 31st. I know a sticking point for me is, you said 2010 Dietary Guidelines. We did in fact complete the process as the law requires us to do in 5 years. And we actually were finished with the document in December. But because we needed to get both secretaries together for this event, which is very difficult to do, Secretary Sebelius and Secretary Vilsack, we ended up finding January 31st as a perfect date. So there's no other urban myth out there as to why we were delayed other than finding a good time for both secretaries to be available. And so we've got the jump-off point for a very robust communications effort. So now I've really collapsed 4.5 years in a matter of what, 30 seconds? And at the implementation point of view, or by the time we get to implementation, I think I've got, there you go, not that you couldn't see it before. School meals, all based on, school meal patterns are based on the Dietary Guidelines. Nutrition facts, that's a way to implement the Dietary Guidelines for Americans. School meal patterns, well, you've got what schools put together and offer in terms of free or reduced lunches. That's based on the meal patterns that are then based on or sourced from the Dietary Guidelines for Americans. We have curricula like Nutrition Essentials. We've got front-of-pack labeling efforts. They're underway right now. There's also a federal sector effort to establish a uniform front-of-pack labeling scheme. That's all based on the Dietary Guidelines for Americans. We've got the Eating Healthy at a Low Income, the market baskets that support the Thrifty Food Plan, which is the way the allotments are formed for the SNAP program, what used to be known as food stamps. Here again, based on the Dietary Guidelines for Americans. So my point here is there's an awful lot of implementation that goes on in the way of federal sector programs, in private sector programs, in ways to reach consumers in neat and novel ways, under mandates that exist, to give information to consumers to get them to hopefully make those healthier choices over time and change behaviors to more healthier behaviors. So we get into the implementation stage, and which is where we are right now. So it takes more than just these programs, though, to reach consumers. In many cases, these are consumers that have a need for receiving nutrients because of their particular circumstance. In some cases, we've got an upcoming requirement, for example, for menus to bear calorie information, and then for other nutrition information to be available at quick-serve restaurants. You know, all of that is coming down the pike, and obviously that reaches consumers in a sector or in a place where they need to make a food decision, and that's very important. But it takes something more comprehensive, I think, to make sure this happens. And that's what we've created, and we've actually built into this whole communications effort, for which the MyPlate icon is a centerpiece. The last thing I have down there, I think, is ads to kids, and I am working on an effort with colleagues at CDC and FDA, as well as FTC, the Federal Trade Commission, on setting or developing recommendations for nutrition principles for the foods that should be eligible for advertising to children because of the influence that advertising has. So that's another case where the dietary guidelines are the basis for any programs that result from that. So a lot going on right now, believe it or not. It's happening every day and in all sorts of neat and novel ways. If you were to get into the Dietary Guidelines for Americans, and I'm sure you all have your personalized copy, and it kind of looks dog-eared like mine does, please, I mean, it is probably the most, well, the best version of the guidelines yet, I think, and clear and applicable. If you were to look into the major themes in the guidelines, you'll see that there's an emphasis on calorie balance, on balancing calories to manage weight. We are at calorie imbalance in this country. We are consuming far too many calories for the amount of exercise that we commit to. We also know that we need to shift our eating patterns to consume less often foods that are significant sources of calories from added sugars and solid fats, and also foods that are significant sources of sodium. And we also know we need to shift our eating patterns to consume more often foods for the nutrients they provide, more nutrient-dense foods, and more foods like fruits and vegetables, low-fat and fat-free, dairy products, whole grains, as well as seafood. These are all the essential themes in the Dietary Guidelines 2010. Building healthy eating patterns is not a prescription. For the first time, there's a chapter devoted to the idea that eating patterns should really reflect your personal tastes, your culture. You should enjoy food, enjoy your food, but eat less. And in fact, that's one of our messages. It's a matter of knowing that there are model food patterns, and you can choose the food pattern that meets your needs. Around the world, we know that there are positive health outcomes in a lot of places where they tend to eat more vegetable or plant-based foods. And we took that into consideration, or I should say the Dietary Guidelines Advisory Committee did, and created the notion that there are models that we could follow, but there's not one prescription. There's no Western style of eating. And in that regard, for the first time, we created food patterns for vegans and for lacto-ovo vegetarians. And so it is a matter really of meeting your calorie needs, working within your calorie needs, expending energy to balance those calories, and also getting the nutrients you need from foods. Another important chapter that really relates to communications is the idea that we have a very complex food environment. And the Dietary Guidelines has a chapter, in fact the last chapter, that really recognizes this socio-ecological framework that we have to deal with, that there's a responsibility and a part for everybody to play at a different level of society, and that we all bring something different to the mix to really transfer information to consumers wherever they need to make food decisions. And this is very important. It's the first time we really realized that there's an awful lot of literature out there that reports to the influences of things around us on our food decisions and how complex it is to create a really good communications program or outreach to help people change their behaviors. So I invite you to read that chapter. It really is the the background or the backup to our communications efforts, and really forms our idea of making our efforts a multi-sectoral effort and certainly a partnership effort in reaching consumers. So along the way of this 4.5-year or so process for developing the guidelines, about halfway through we begin to track the work of the Dietary Guidelines Advisory Committee from the communication standpoint. And we begin to build out what we think a plan would be to address what are forming as ultimate recommendations from the committee. And so we begin really early on. And in fact, I think the committee was meeting in its second year, and we were planning out the kind of consumer research that we would need to do this time. We were also engaging stakeholders and thought leaders and doing environmental scans to get a sense of what we did right in previous attempts and what we could do better in future attempts. So as I said, we had an iterative research plan. We did, in fact, interview our federal partners because the USDA Center for Nutrition Policy and Promotion, even though it is the center of the universe when it comes to nutrition, we think, there are other federal partners out there. And so we did we did, in fact, interview these federal partners for their views, for their needs, for the implications they may have in communicating. We did a media analysis of the 2005 Dietary Guidelines. It's fascinating that you can go back and look at the media coverage and what the media found helpful or not when it comes to communications. And so we did that as well. I mentioned the environmental scan. So we did, in fact, engage thought leaders and communicators, nutrition educators, as well as stakeholders to get an idea of what would work, should we try, and the kinds of things we could put into a consumer research effort. We did conduct consumer focus groups. We tested messages drawn from the dietary guidelines, and we also tested icons for a reason. And then we also followed up with quantitative surveys that had a nationally representative sample of adults, and we oversampled for low income and low education. The first time we had done that in messaging efforts, creating messages in the federal sector, and at least for the dietary guidelines. And we did include kids, children, in our test population. So we felt good that ultimately the messages that we would derive really would be understood by a vast number of Americans and not just oriented toward one segment. We also found some very interesting things when it came to our research findings. We found that consumers know the basics about healthy eating, but they didn't necessarily get the sense of what calories are or how to necessarily count them personally. Personally. Then the issue of portions. You know, is it a serving? Is it an amount? Is it a cup? That seems to be a sticking point with consumers. So we know as we build our messaging programs in the future, we're going to have to deal with these two concepts and try to get them out there in ways consumers will understand them and then actually adopt behaviors or applications that are really helpful for them. We found that no one message, tip, or graphic appealed to everyone. Interesting. It wasn't just an easy result of our testing to find one version of a message was a success as compared to, or would be the best compared to others. But we did go for the ones that received the majority of the sense that consumers would relate to it and apply it. And then we found that when it came to images, we tested icons. A plate image, of all the ones that we tested, a plate image conveyed a positive message about eating healthy, and that's eating healthfully at mealtimes. So among the different icons, that was something very useful for us to find. I've added protein foods and dairy foods. I think this is an often asked question. We no longer have a meat and beans group, food group. What we found in our testing was that no one understood that meat and beans also included seafood, or meat and beans also included other protein sources, which could very well be vegetable sources. We found that dairy foods is a better term. Consumers understood that, They understood that butter is in the dairy food group. But we found that when it was milk and milk products, most adults were turned off because they don't necessarily drink milk or milk products anymore. So new information helped us rename these two food groups. And I know that's an often asked question, but I thought I'd put that here as one of our key formative research findings. So I mentioned that we look to stakeholders and to educators, nutrition educators, and to our partners in the federal sector and others out there that have a relationship with communicating with consumers in the nutrition area. And we knew that we needed to consider these things in any plan that we created for the 2010 Dietary Guidelines. When it comes to consumers, we know that there is a difference among consumers in terms of receptiveness and stages of change. They have different values, different priorities, different cultural habits. And so that would then help us, or that did help us understand that we needed to create a variety of modes of communication, ones that were attractive to individuals who were receptive to change, and others who really needed that tipping point to really to make a definite decision to make a change toward healthful eating habits. We also know that we needed to, from our consumer testing and other research, that we needed to design actionable, simple, direct, consistent, understandable messages to positively affect behavior. And what that came down to was understanding we finally need to get how-tos to consumers. They not only need the information, and we've got the best science behind our nutrition messages. Just giving them information isn't enough. We need to give them the portfolio of how-tos, knowing that if you give a consumer 20 ways to make a change or shift an eating pattern, that at least one of them will resonate with them, and they're likely to follow it based on their personal characteristics. Providing messages in places to reach consumers at the moment they need them, and making them sticky so that they stay with the individual and they're just not lost, but then they're there and they're aware of them and they remain in a sustained state. That became a very important part of the effort that we were going to create. And this gets back to the idea that we needed to reach people really where they need to make food decisions. And we needed partners to help us do that. Using information technology, so media and modes, using them creatively to magnify the messages. Very important. We can't just do it alone from the federal sector, certainly not from an agency. We don't have all the resources. We really need to have an effect of using today's information technology. And that's also built into our program that I'll describe. And then we also understand that not all consumers have access to modes, all modes or media options. And so we have to be sensitive to that and provide information, in contrast to information technology, provide hard copies or actual written materials to consumers as well. So all of this factored into our plan. Now I'm sure some of you are saying, whatever happened to my pyramid? Maybe not. But I've heard people ask that. I can tell you this, there are similarities, and these are those. Both are graphics based on the food groups. That, I think, is a reasonable comparison. ChooseMyPlate.gov, which is our new website, contains much of the same information as the previous site, the previous USDA website, because all the information is based on the Dietary Guidelines for Americans. In other words, it's a matter of implementing food patterns, model food patterns, helping consumers understand the amount of food groups, the amount of whole grains or protein foods that are relevant to their nutritional needs, to the food groups that relate to their calorie level. And that then is essentially the same. That's a fair comparison. But it sort of stops there. These are really the differences, and they are substantial differences. On one hand, you've got the pyramid, which is a great teaching tool. It's really great in a classroom. We understand that, and we're not denying that. It is based, it's a teaching tool, and it was designed in 2005, or 2003, 2004, and then released in 2005, it was designed to represent the majority of the dietary guidelines recommendations. That actually might be the downfall here, in that we've got recommendations that are rather complex, and certainly for a visual cue, too complicated for everyday consumers. So what we needed was really a simple and powerful reminder to eat healthy at mealtimes. And that's what we drew out of our consumer research. The difference here is that the MyPlate really resonates on a meal basis. We found out consumers really said it reflected dinner. Not necessarily breakfast, not necessarily lunch, but dinner most of the time. And then it was it came out in our testing as a great, uncomplicated visual cue. On the other side, my pyramid was developed to represent the intake for a whole day. So therefore, it really was a matter of a picture of the dietary guidelines. MyPlate is not. MyPlate's a visual cue. And as I said before, it's great in classrooms. So those are the differences, and I hope they're clear, and I'll be happy when we finish to take more questions about this. But I think this has been an issue that's been brought up. Certainly there's a paradigm shift here, and that is a lot of educators are out there. They've invested in my pyramid, and we're understanding that it really needs to remain on the nutrition education reference shelf, which is, by the way, where you'll find it at choosemyplate.gov. But we need something different to really engage consumers, that powerful reminder, hey, I need to think before I eat. And that's what MyPlate is all about. Now, how did we get to this point? Why did we get to this point? Well, as an active member of the White House Childhood Obesity Task Force, the center was challenged to contribute a couple of things. All agencies are actually part of that network in this administration. And we're supposed to be working together, and we are very, very avidly, in helping make sure that we have a healthier generation for tomorrow, certainly more active generation. And so we were tasked to develop the Dietary Guidelines for Americans, which is something we did, and we released, as I mentioned. And the other thing was to think about a new generation icon. That there had been thoughts and views that perhaps the pyramid was too complicated to be that everyday cue that really moved people a little bit in the right direction. And that's how we got into the whole issue of thinking about a different icon and for a different purpose. And so we lived up to the challenge, and we certainly fulfilled it. And part of the effort, obviously, around MyPlate as a centerpiece is to have this robust campaign to communicate the dietary guidelines. As I mentioned before, multimodal effect or approach is needed. We definitely needed to sustain momentum on a long-term basis. We also needed to ultimately help in a way to get people to change behaviors. What we have are really 4 components to our effort here. Coordinated messaging. I talked about simple, understandable messages, messages easy to apply, and that's what our first component is all about. Certainly, surrounding MyPlate, the MyPlate icon, are all of the messages I'll mention in a moment. And then along with them come these very important how-tos, how to put these messages into action. Another component is partnerships. Another component is social media and buzz activities around our messaging. And another is the development of interactive tools and resources, which is the place that consumers would go or could go, and nutrition educators and clinicians and health professionals will be able to go to apply the dietary guidelines, to learn about the dietary guidelines, and then actually apply them in a personal way, in an interactive way. So this is our multi-component, multi-modal campaign. I'm not sure if many of you have seen this. Hopefully you have. This is kind of a new approach, a fresh approach for the department. And we're kind of working along the way that a lot of the media folks work, in that they have editorial calendars and they think forward, they work forward. And so we have done this in the same way here. We have a message calendar. And so all of our partners, whether they're federal or private sector, can now know where we are on the calendar in terms of the emphasis on a selected key message. You see a theme here. Those relate to those themes in the chapters in the dietary guidelines. So between September and December of this year, we've been emphasizing make half your plate fruits and vegetables. That relates to the recommendations in the theme area of foods to increase. And with that comes an awful lot of how-tos. It could be an easy way to make a salad. It could be an easy way to get more steamed vegetables in your meals. During January to April of next year, related to balancing calories, the message that we'll focus on, along with our partners, is enjoy your food but eat less. We're looking forward to that. Certainly a good New Year's resolution theme or message. And then, as you see, we have messages coming out for a 3-month period. So we're not going to bombard consumers or confuse them with multiple messages. That all the federal agencies involved in this, and our partners as well, will focus on a message at a time. And in that regard, we're sure to grasp consumers' attention. And so obviously, as you see, we go through, related to the themes, the 7 total tested messages that we released along with MyPlate on June 2nd. There are 16 messages in total. Actually, they're all found in our consumer brochure, which is oriented toward consumers and relates to the dietary guidelines on a consumer level. Oh, I forgot my little check mark there. All right. Okay, I talked about how-tos, getting them out in all sorts of neat and novel ways. We created a consumer brochure that relates to 16 different tested messages that came from our consumer research. The idea that posters are great for classrooms, they're great for community centers, they're great for doctors' offices, so we're not giving up on hard copies of materials. We know that videos and other ways to reach consumers, very important. That's where you'll find those at choosemyplate.gov. Menus, what a great way, what a great how-to. So we've created a 2,000-calorie menu of foods that are low-cost foods that for a week, actually for 7 days, that actually meet the dietary guidelines for Americans. So it can be done. And then recipes that are relative to, or actually they meet the guidelines. Those are available as well. We created a 10 Tips Nutrition Education series. Consumers love 10 of everything, it seems. And so they're on a variety of topics that are all timely topics. These are all based on the dietary guidelines. So here again, they meet the scientific requirements, but they're stated in a way and they're provided in a way that anyone out there in the nutrition education world would have an instant 10 ways to apply one of the messages that we've identified. Online tools are out there. I'll give you a little tour of those. And then we're going to create and have created buzz activities for each of these messages so that it's not only the federal sector, but our private sector partners that are actually doing something to magnify the reach of the messages I mentioned. This is a new poster. Sort of capture it right now, memorize it, because it's not out yet, so you're getting a little sneak preview. We're kind of charged by a lot of this because, for instance, these plates are all recipes that meet the dietary guidelines for Americans. They've recipes that were winners of challenges, public challenges, to develop foods that meet the dietary guidelines for Americans. And so we think that it's a neat way of bringing a sense of reality to the guidelines and helping people understand this is an actual way to build out a healthy plate. We're coming soon. Coming soon will be a kids poster. Here again, these are the foods that were the winners of the schools, the Chefs Move to Schools Challenge that the Food and Nutrition Service in USDA conducted. And we're really happy to see that these foods actually make it to real life and to pictures and will be there in the school environment so that kids could get a sense of what it means to build a healthy meal at lunchtime. We have considered that when it comes to obesity and the increasing rates for overweight and obesity, and of course the issues with chronic illnesses, or the increases in chronic diet-related chronic illnesses, that really primary language it doesn't stop at primary language. That regardless of your primary language, we've got a concern about these alarming trends for these public health problems. And so we did in fact create Mi Plato, which is the Spanish translation version of MyPlate, and we released it at the White House along with Sam Cass there, the White House chef, and Secretary Salazar, who's in the Interior Department. That's not me picketing outside the White House, but some actually one of our interns, it went viral by the time I got back to the office, with this, I think the little phrase that government executive pickets against, you know, what's on your plate in Spanish. But the fact of the matter is it's been a huge success, especially for the educators out there, nutrition educators who are interested in these materials for their clients and their customers and their stakeholders, to provide this information in a language they can instantly relate to. So we're happy about this, and there'll be more information in Spanish coming. I mentioned the resources, and they're there. We've actually translated our 10-tip series in Spanish as well. These are some of the things that our partners are doing out there in the nutrition education world. To be a partner means consistency with the Dietary Guidelines for Americans, and so all the materials you see here, you know, in terms of posters for various audiences, or lesson plans, or DVDs, and other kinds of materials, they're all out there. They're all being distributed, and the reach is vast when it comes to the efforts of our nutrition education partners. So we're happy about that, and then there is consistency. To be a partner means consistency, signing on and being consistent with the Dietary Guidelines. So look for these. We give a shout out to our partners on our website, and you can actually find the efforts that they have underway in the information at our website, choosemyplate.gov. This is one of those buzz activities we're really excited about. We've got about 5,000 followers right now, and dozens of submissions, and expect by November 15th. Everybody works on a deadline, right? That will have even more submissions of a 30-second video on how you can make half your plate fruits and vegetables on a budget. And it's obviously very timely, and also it relates to the first message in our message communications calendar. So we're excited about this. There are cash prizes. There are themes related to information for parents, videos related to parents, videos related to children, and another category as well. So if you haven't voted, please, I invite you, go online, vote. If you are interested in submitting a video, please do, because we're really excited about this. And this shows you that there's really a lot of public engagement. It runs, it actually comes from the success of our Apps for Healthy Kids Challenge. We challenged entrepreneurs and college students and others out there last year in taking our nutrition information, the databases that we have that drive our tools online, using that information to create an app or an e-tool for helping kids make healthier choices. And that was a very successful public challenge, public contest. And so we know that you can engage the public in these kinds of efforts. And so we're finding success in this as well. Partnerships. I mentioned partnerships. We can't do it alone. We've got 5,000, actually 5,035, I think, as of today. And there's a little ticker on our website to give you the number of our community-based partners. These are organizations like hospitals and PTAs and schools and individuals who are out there as consultants in the nutrition education area or nutrition communications area. They are engaged in their communities or even on a smaller basis in a classroom, but they're willing and they have signed on to take the materials we create and create their own materials and actually magnify our messages and magnify the reach of the Dietary Guidelines. That's fantastic. We haven't had that before, and of course we've built this since June of this year. So we're extremely happy with the partnerships. These are unassisted, they're non-funded relationships that are cooperative agreements that we've created with an awful lot of these organizations, and we're very happy about it. At the national level, we have national strategic partners, and these are organizations that have a reach across the United States. They have resources that enable them to reach consumers in a lot of interesting and creative ways, and they represent the sectors that we need to engage when it comes to the food environment. So we've got members at the national level who are appliance manufacturers. They are in the restaurant area, National Restaurant Association, for example, the Food Marketing Institute, so we've got supermarkets represented. We've got organizations like the American Dietetic Association, the Institute of Food Technologists. We've got organizations that are in the media, in popular press. They're just in just about every sector, and that's our goal, is to ensure that we have a reach through these organizations because they bring expertise and a way to communicate to consumers in a way that we can't possibly do. They are very important to us. So partnerships, public-private partnerships, I can't stress that enough. It is the way we are operating now and will in the future. And obviously it works. These are some of our partners. Got to catch them quick. But it's interesting to note, I mean, there's something and probably a message and a time for a message for each one of these organizations. A lot of the organizations probably find Make Half Your Plate Fruits and Vegetables is something they can really get behind. So we had some really great efforts by the Produce for Better Health Foundation, for example, and their MyPlate Makeover Challenge. We're happy to see this, and when they sign on these cooperative agreements, by the way, it is so that all the materials they present are consistent with the Dietary Guidelines for Americans. So we're happy with this kind of challenge and the reach that it has. Birdseye had and Birdseye and actually Share Our Strength, another one of our partners, joined forces for a farmers market event in Union Square in New York last month and accentuated the ability or the ease and the way that you can create healthful plates with more fruits and vegetables. We had the National Restaurant Association produce a YouTube video that shows restaurant managers, restaurant operators, how they can actually create more healthful foods for children, more offerings for their menus at their locations. And it sort of builds out the National Restaurant Association Kids Live Well program, which is promoting more healthful options on menus for children. So here again, absolutely in line with the dietary guidelines and a great effort, we think. Aldi out there is an example of a partner in the marketing or the supermarket area, is out there with identifying the lower cost items in their stores that actually are healthful choices to build a healthy plate. So definitely another way to use our icon and commit to and transfer a message that relates to the dietary guidelines. This is kind of neat. GE is what, the largest manufacturer of consumer microwaves out there? Well, there's a MyPlate button on the new version of the microwave because they're reminding people in the recipes and in the cookbooks they're offering, or that come with their microwaves, that you can steam vegetables, right? You don't need to batter them and then fry them. So General Electric, they've been a great partner in this way, and so they're out there with this. So I think that's definitely an innovative, kind of neat way and a different kind of sector and partnership to reach consumers. We are redesigning. See, we're never standing still. So here we launched ChooseMyPlate.gov in June, and already we're redesigning it. But the fact of the matter is, this was part of our plan all along to make it more user-friendly, to add in more features and capabilities. And so just know that in the next few months, this fall, we will be releasing a redesigned website. And on it, you'll find that in all ways, the 2010 Dietary Guidelines for Americans are represented. The information behind the dietary guidelines is fully inserted in the information you'll find about grains, about all the other food groups, about food patterns or eating patterns, and what it means to build a healthy eating pattern. All the information there will be updated and to reflect the latest science. And then what we have coming up for the beginning of next year is the launch of a new tool. So I mentioned one of our other components of our plan is to make sure that we reach people through consumers and professionals and educators and nutritionists or dietitians in innovative ways, and obviously reaching them through a really great e-tool is one way to do it. So we have a history at USDA of an awful lot of engaging e-tools. We have ways to assess your dietary intake compared to the dietary guidelines. We have ways of choosing a food or two different foods and comparing their nutritional content and the food groups they contribute to meet the dietary guidelines recommendations. You can figure out how many empty calories are found in two different foods, even when you add all the extras like, fat-free milk or a full-fat milk. So we have those tools already, but we need to make them even more engaging, useful, user-friendly, and updated. And so that's the effort here. And what we will be launching, and what this is a sneak preview of, is the Super Tracker. It is the only place in the federal government where you will be able to assess your dietary intake, have a weight management tool, and a physical activity tracking tool that's personalized for your habits in terms of physical activity. The physical activity guidelines were released in 2008 by the Department of Health and Human Services, but there's not an interactive tool to date. We will have that interactive tool, and we're benefited by the help of the Department of Health and Human Services in helping us make sure that it is just the best feature there is. So personalized nutrition and physical activity plans are possible, and that's what this is all about, tracking foods and physical activities to see how they stack up compared to the dietary guidelines or physical activity guidelines, getting tips and support. So there will be coaching functions, there will be recipe building functions, menu building functions, and an awful lot of other features. These are some of the features that will be on the Super Tracker. You can look up the nutritional information for over 8,000 foods and compare foods on a side-by-side basis. 8,000 is pretty good. And the uniqueness of this database is that it gives you the food group contributions for all these foods. The food tracker helps you track the foods you eat and compare to get your nutritional targets. The top goals here allow you to choose 5 personal goals and help you track whether in fact you meet them or not, and then give you a coach to help you meet them. You can track physical activity, and you can also get an awful lot of reports. This is the screenshot of the Super Tracker homepage. You can see here there are a lot of other features. The features are here. This is what it'll look like. There are tiered experiences here. You can get on and you can just play around, or you can become a registered user and keep all of your data online and in a record for you and only you to use. So it has great application for those out there in the nutritional setting or in the nutritional guidance or clinical setting, as well as individuals or even students in a classroom. The coaching center is just fantastic. I think some of these relate to, in this case, you can make a decision. This is like a player piano, right? You can actually pick the food among the pizza choices here and compare 2 different types of pizzas and choose the one with lower calories or lower calories from solid fats and added sugars, and get the full nutritional breakout as well for both products. And if you're looking to find more calcium in your diet or less, or more sodium or less, it will help you make the choice between 2 different foods. So we think that's kind of neat, and with it comes the coaching component to help you decide maybe there's another food or another choice to make. There's another feature, there are other features, the reporting features, for example. You'll be able to get reports out on the food groups that you've consumed over a day or a week or a month or a year, and how you're doing according to the dietary guidelines. You can isolate a nutrient or 2 that you have an interest in tracking. So you'll be able to find out where your sodium is coming from every day and track that in a bar chart or in a graph and in a report that's just for you. You'll be able to get a summary of the meals and how your meals are composed over time, over a day or over a week or a year. Physical activity, as I said, will be tracked, and I'll show you that in a minute. And then you'll be able to get history charts. You'll get to identify how your weight has changed over time, and perhaps have a journal. There's a journal opportunity here where you can put in your own notes about what you might have experienced to have suddenly a weight gain of 5 pounds and then a weight loss of 2 pounds. And so those kinds of capabilities obviously will be very helpful. Let me see. I skipped the physical activity, but for the sake of time, I won't go on. So I've given you a lot of information, and obviously all of you are probably perfect candidates for considering membership as a community-based partner. In terms of what you can do, obviously promoting the guidelines with us in a coordinated way according to our multi-year plan, I think that would be extremely helpful for us. Using the new MyPlate icon as that visual cue, I think that would be very helpful to us. Driving consumers to our tools and our other resources at choosemyplate.gov. Supplementing the 2010 Dietary Guidelines messages that I listed with how-tos that appeal to the constituents that you deal with or to the stakeholders you deal with. Becoming a community partner, I mentioned that. Promoting and encouraging the participation in our videos challenge, and then future Buzz activities, other challenges that will be coming along that are public-oriented. These are ideas for getting started now. These are online. There's a lot of other help material for those who want to become a community or a national strategic partner. There's a tutorial, essentially, for the simple process for helping us magnify the reach of the dietary guidelines. Really what we're after here is setting the stage for lifelong healthy eating behaviors. As I said, it's a matter of healthy eating behaviors that are really flexible, that meet your needs, that are balanced with physical activity. MyPlate actually symbolizes healthy meal times and building healthy plates at meal times. And so that embodies that notion that there is no prescription for a healthy eating pattern, that it's personalized, but it follows the tenets of the dietary guidelines. We are about empowering individuals and not dictating to them with improved literacy, hopefully, to make those choices ultimately, act on those how-tos. We think that's extremely powerful. Helping Americans make those healthy choices requires influencers. That's part of this socio-ecological framework. And so you all represent influencers that we could really use as partners. And then metrics and measurements, very important. I think the last point is that all of our partners have signed on to measure the effectiveness of the efforts they have underway to help us. And we in the federal sector have also committed to develop those metrics and measurements as well, so that we, over time, will be able to show our effectiveness regardless of the approach that we're taking in this multimodal, multimedia effort. So with that, I could, I think, take questions.
Great. Thank you very much. We have time for a few questions, and then there's a reception upstairs.
Comments allowed as well?
Sure.
Okay. Thanks very much for talking to us about your efforts there at the USDA. I was just, this is not an easy comment, and you probably heard it in some form or fashion from various trackers of your efforts. But I feel that part of the presentation, part of the rhetoric delivered is a bit too easy, is a bit too all permissive. I feel that there are losers in this game. You cannot look at an epidemic of obesity, which is plaguing certain populations, mostly low-income people, for very mostly socioeconomic aspects of food provision, and say, yes, it's purely customizable. We shouldn't cut down on red meat and high-fat dairy products, and focus not on green vegetables and whole grains as opposed to starchy foods. I feel that are the partners influencing the USDA, or USDA influencing the partners? Maybe a bit of both. And in particular, one of the things that seems to be somewhat of a problem is that what are the real causes of the rising epidemic in obesity? The USDOL put out a chart this year, which they did a longitudinal study, healthy foods versus junk foods. Prices are somewhat at an equilibrium in 1970. By now, the healthy foods are much more expensive, and the junk foods are much cheaper relative to real dollars. So I was just wondering, so there's some of that edge to my comment, but also a question, which is, how is your program working to address the kind of fundamental supply chain issues pertaining to these more economically driven causes of the obesity epidemic? Thanks very much.
The emphasis on the food environment is very important. It's the first time that we've collected and researched, or analyzed the research, and the Dietary Guidelines Advisory Committee helped us in that regard to recognize how complex this is. Obviously, we've tripled the obesity rate, in the last 30 years. It's not going to be undone so easily, but there is a stepwise approach. There is this multi-sectoral approach. I mean, that has been documented. Mary Story has done a fantastic job in setting out this socio-ecological framework. We believe in that. We believe that there is a role for every individual, every family, every parent, every company, every healthcare organization to really play in getting this information out. And it is so complex that you need to think about behavioral economics. You need to think about the influence of advertising. You need to think about building easier ways to walk to work. You need to think about getting better school meals in schools. You need to think about getting more options in restaurants, where we seem to be increasing our
Increasing fast food restaurant presence, increasing grocery store availability in low-income neighborhoods.
And access.
Will not create, because the market has created these outcomes.
And then the issue of access is another one. So what it takes is, it does take this concerted effort. There are efforts in all of these areas underway to make the changes. It will not happen immediately, but there are efforts. The White House Childhood Obesity Task Force is a perfect example of a systems-wide approach to deal with these kinds of things, to get more fruits and vegetables where they're needed, to fill in gaps where you've got food deserts. This is not rhetoric. It's there and it's reportable. If you want results right now, you're not necessarily going to find them, but you will find them over time because of the commitment to these kinds of programs.
Hi. Hello. So far, since, I don't know, 1973, since the first USDA guidelines have been introduced, we've seen an increase in the incidence of heart disease, an increase in the incidence of obesity and overweight. And yet the basic tenets of the food pyramid, while it's changed in terms of a graphic, really haven't changed in terms of proportionality so much of the various types groups of calories. How, and in my opinion, the real cause of obesity and overweight and the subsequent dietary diseases are related to the role of sugar, refined sugars, refined carbohydrates that are introduced into the diet and have been a result of this somewhat, I would claim, dogmatic, low-fat diet that we've put out there, recommended by the government. And so how does this address the role of refined sugars and refined carbohydrates into the diets of Americans?
One of the concepts in the dietary guidelines, well, first of all, you've got a nutrition, you've got an evidence-based approach to the development of the science behind the dietary guidelines. Going into the Nutrition Evidence Library will give you the transparent access to all of the research that was considered, the worksheets, the synthesis that this Dietary Guidelines Advisory Committee went through. The conclusions of the committee was that our problem is the number of calories that we consume from added sugars and solid fats, typically in combination. And it's not separating out any of the specific sources of sugars or types of sugars. We are consuming between 600 to 800 of our calories every day from solid fats and added sugars. Those are empty calories. We should be consuming something like 267 calories in a 2,000 calorie diet. That's our problem, and we need to shift our eating patterns. If in fact we live up to the dietary guidelines, this is all about food patterns, building healthy food patterns, by picking what works for you. And as I said, it could be that if you're not someone that consumes meat, you could choose other sources of protein. If you don't consume dairy products, you can get your calcium from other sources as well. But right now, 15% of us are actually consuming the whole grains in the amount recommended. 42% are consuming the fruits, the amount of fruits that are recommended. We've got a long way to go to shift that. And we really believe that providing a focused message and helping consumers understand there are easy ways to achieve these small things to make a difference. That's, we've got to start at a simple message. We've got to start, because complex doesn't work.
Carbohydrates have increased dramatically over the past 30 years, 40 years. And what we've seen is a rise in these diseases. But it seems that the science that supports this is totally ignored by the USDA.
I'll go back to the nutritionevidencelibrary.gov and all the current science that led to the recommendations that relate to the state of nutrition when it comes to sugars is there.
Other questions?
One thought and one question. Why is the dairy in a separate little section when you initially said adults don't like milk products? Why don't you put dairy in the plate?
Because consumers didn't understand how, for those that do drink milk, how you would get that on a plate. It just wasn't, it was not, seriously, it was not something they saw as a logical placement. And actually that's a top-down cup or it's a dairy plate. And that's the way it came through testing.
Second is a suggestion. You didn't mention television and really cute, snappy ads during popular TV shows like Glee and Modern Family would be a pretty good way to communicate this.
Yes, and I think that's where we hope that partners come to us to build out our PSA ability and get us, during prime time, and not at 12 at midnight, to get these messages out. So we are working with partners. There's a lot of way with a lot of the with food-related channels, the food channel channels, as well as the kids programming, where we've got discussions underway to expand in those public television as well.
I was just wondering if you could comment on the ways that you're planning to measure the success of the program. You said that that's underway and something you're going to tackle, but can you comment more specifically on some of those?
See, this is where I get to turn around and ask you I can question you. We would be happy to receive ideas of how we should tackle these. We are working now since June. I mean, we embarked on this in June. We are working now on what would be appropriate metrics, considering we've got a lot of different avenues for reaching consumers. Whether it is television or PSAs or simple posters or the side of a bus. How are we reaching consumers? How can we measure that? So we're working on that now with our partners. And over the next year, we'll be able to report out, and we should have a great report of where we are, at the year anniversary of our partnering efforts.
Okay, we have time for one more question, and then there's a reception upstairs if people would like to continue to ask Dr. Post some questions. Is there a final question?
Right here.
Yes.
So, first of all, I really like the MyPlate. I think it communicates the idea very much better than the pyramid. But I was sort of wondering, because it still is the same messaging, and did you all ever consider anything more aggressive like taxation, or just trying to really sort of shift, sort of like what Denmark did with taxing saturated fat food? And I know that they had a beverage tax a little while ago that was sort of not really clear how well it worked. But did you all ever consider anything more aggressive?
Well, here I'm focusing on communication outreach related to the dietary guidelines. There are bigger efforts like that still need to be considered by agencies like the Economic Research Service in USDA, by our partners over in the Department of Health and Human Services as well. So ideas like that are being considered. The Economic Research Service established a Behavioral Economics Center, and they're conducting research now to build up the knowledge, because there just isn't a firm knowledge base on the value and the benefits of taxes toward incentivizing, or influencing choices. More work is needed.
Okay, Dr. Post, thank you very much for an interesting talk. Great, thank you.